Thank you for joining us for another episode of Conversations with the County Executive. And joining me, of course, is County Executive Rich Fitzgerald. Good morning.
Good to be with you.
We're talking a little bit about health today, and we're joined by former Allegheny County Health Department Director and now Director of CDC's National Center for Chronic Disease Prevention and Health Promotion, Dr. Karen Hacker, along with, again, former Health Department Director, Dr. Debra Bogen, who is now the Acting Secretary for the Pennsylvania Department of Health. Ladies, good morning.
So one of the things as county executive that I wanted to see was an elevated Allegheny County Health Department that was improving people's health, but also was known and had a reputation for being able to improve health within the county and quite frankly, within the region. So what were some of your goals as you came in and were starting to run the Allegheny County Health Department?
So I think my first interest was in understanding more about the county and trying to really understand where the big challenges were. It was a new place for me, and I think you really helped with the history of the place and really understanding that. So when I came in, I was really interested in the environment surrounding people and how to make that environment as healthy as possible so that it would be as easy as possible to make healthy choices. And the Live Well Allegheny program, I think, really took off from there, which was, how do we make sure people have access to healthy food and exercise and green space and all those things. And, over time, I think we got a large number of the 130 municipalities to join us and spent a lot of great weekends going to various events, sort of seeing how excited folks were about doing stuff like this. But, we also had all of the challenges with air quality, and I think we spent an enormous amount of time focusing on how best to address those issues and did have some success, although, of course, it's not always what everybody wanted. It's not perfection, but we did make some real progress. We also made some real progress, I think, in the opioid epidemic, which was not something I was prepared for when I came in, because I wasn't expecting that. And that was something that really hit us. And I think there was a huge outpouring of support as we got Narcan on the streets. And at least in my time, and I know some things have changed since then, that we actually saw improvement in the number of overdoses. But there's a lot of other ones, the lead problem that we were dealing with, and some of the successes that we were able to do, like getting lead screening mandatory for all children in Allegheny County, I thought was just a great success.
Well, first, I just want to thank you, Rich, for I had an incredible experience as the county health director. I came in at a very unusual time in public health because I came in March of 2020 when the pandemic was really starting. And so I had a very unique experience, and you and your team really helped because unlike other places, you stood by the county health department through it all and just really helped us get through it. You and your entire staff. I'll never forget that Jen Liptak called me just a couple of weeks into my job, and she said, Dr. Bogen, I want to remind you that you are not an island and the health department is not an island, and we're all here to help. And so I just want to thank you and your staff for really making my time at the health department incredible. So when I first took the job, or was thinking about taking the job, I was very excited about working in the maternal child health arena, which we've renamed family health, really, which is a really important part, looking at quality improvement across the health department and process improvement, of course, addressing environmental health issues that the county faced. But I wound up spending a lot of my first couple of years really focused on the COVID. But we did really continue to address lots of what I call bread and butter parts of public health, food safety, in county plumbing safety, air quality. All of the groups that were doing work really continued to do their work. And that's evidenced by the fact that we passed and updated regulations in the county that hadn't been updated for a long time. And I was able to do the work I did really because I followed Karen Hacker. And Karen came in, and Dr. Hacker really laid the foundation for me being able to really follow on her work. So she reorganized the health department, and then I just made little tweaks to how that was organized. But I really followed in her footsteps because she really organized the health department in an amazing way. So my priorities obviously changed with the pandemic, but I was still able to work on many of the issues, the opioid crisis, family health, the WIC program, and other things that I came in as priority areas.
What were some of the challenges that you saw, both internally and externally, within the department or within county government, the bureaucracy that, working with various governments, the state, the county, but also externally, working with the corporate community, community groups, citizens, and other stakeholders who were, had something to impart or wanted to see some things that were being done with the Allegheny County Health Department?
I think to really get our work done as public health, you absolutely have to work with all your stakeholders. It really is about communities. It really is about their concerns and how to engage them in the process. We can't do everything in government. We can't do everything at the health department. So our need to be able to work with all of these various community agencies, with all the foundation community, but also with the other agencies in county government, I think was absolutely critical. And we had some great successes. I would say my relationship with economic development was fantastic, and we had some really good experiences with them. We even were able to get grant money to be able to provide to economic development so that we could move our agenda forward. We worked very closely with human services and with all of their various attributes, particularly around the opioid crisis. But also, we were very fortunate, I think, in Allegheny County to have so many organizations. And sometimes that was a little tough because everybody has their opinion and, everybody thinks you're not necessarily doing exactly what they want. But the health department was really able to act as a convener and bring a lot of them together. And so we were able to bring in a fair amount of grant money, both from local as well as federal government. And we were able to give a lot of that to those organizations to work with us. I think some of our grants, we were giving out 80% of the money to the community and engaging in conversations. And I spent a lot of time going out into the community. And I used to say, you just have to keep showing up. It's really important to build that level of trust.
Rich, Allegheny County is a microcosm of the state in that we have a very complex system here. And one of the things, again, thank you and your staff for really explaining to me, but we have 43 school districts. We have over 100 fire departments and police departments. And I came in, as I said, in the midst of a pandemic. And one of the things that you all helped me do is really bring together groups so that we could work really closely with lots of organizations. And one of the successes I think we had was that sort of really focused on working with communities specifically. So I'll give you an example. During COVID, every week for a long time, either myself or Dr. Brink met with the 43 superintendents from the school districts. And we were able to communicate with them and develop programs with them. Same thing with, we worked with Matt Brown and his team to reach the emergency preparedness community, and that kind of working across systems. And again, we worked with foundations. They were an incredible asset. And you all laid the foundation to help us have those collaborations. And that's really what made the time here work really well. And I bring that now to the state, really trying to make sure that the groups that we meet with are the groups that can really bring lots of voices to the table. And so I learned that from my time at Allegheny County, and I'm trying to replicate that experience at the state. So it was a challenge, but it was also one of the successes, is really working with those kinds of groups across lots of diverse groups. Again, from foundations, academia, to businesses, all the way to other government agencies, and across the county departments as well, working with the Parks Department and other things. And so I think, again, I always joke that Allegheny County really is a microcosm of the state because it's so diverse and because it has so many departments within and stakeholder groups. So that's what I think was a challenge, but also an asset.
You were elevated to become the head of the CDC's chronic disease department down in Atlanta. Obviously, they were looking at what the work you had done here in Allegheny County to give you that position. But as you left, what are some of the things you were most proud of in the years you served as the director of the Allegheny County Health Department?
So I think for me, the things I'm most proud of are the things that I feel have been sustained. And I would say some of those include just having a operating health department, honestly. As you know, when I got there, the health department was having a lot of challenges, and we were able to get it accredited and set it up as an organization that could operate. And that was very exciting to see. But some of the regulatory challenges that we faced and some of the successes, those are things that I will always remember. Getting e-cigarettes out of places where you couldn't smoke, getting mandatory lead testing for children. Those are some of the things that have really lasting implications in a community. And I think public health is in a unique position to be able to make those kinds of changes. That said, I really look fondly back on Live Well. I really, despite the challenges, I like the air quality stuff, and it was great to see that we met the national standards, and that we're really able to think very creatively about how to move that agenda forward. So a lot of things that I think were foundational, I certainly learned a tremendous amount. Particularly the history of Allegheny County, which I think is just so fascinating in terms of the challenges that they face today and how the history really put them in those positions, both success, but also some of the challenges that they face. The legacy pollution issues and things like that, but also it is a resource-rich environment. And I often think of Allegheny County as sort of the beginning of the Industrial Revolution in the United States, and sort of what happens when you have the steel industry really get diminished, and what happens when people move out, and what does that leave? So all of that has just left me with such an indelible impression of the county, and I just really want to thank you for the opportunity to serve.
Dr. Bogen, as you left and were tapped to be the Secretary of Health by Governor Shapiro, again, because a lot of the work that he had seen you do and his incoming administration saw you do in Allegheny County throughout COVID and throughout so many of the issues that we deal with here in Allegheny County. What were you most proud of things that you were able to accomplish during your time here as director of the county health department?
I think what I'm most proud of are the people that I hired to help me run the health department, right? I mean, as a director, my job is to make sure that there's sustainability to the programming. And I was able, with the support of your administration, to hire great people in to help me lead the health department. And they're still here doing the great work. And so I'll give you an example. We made the decision as a group to create another deputy within the Department of Health to oversee all the clinical services. And we hired the amazing Dr. Barbara Nightingale, and she has really helped transform our clinical services of the county. And she's continuing to do great work, including really innovative programs. We hired Danae Wilson to be the new deputy in the community health group, and she is doing a great job with the WIC program and really transforming the WIC program. I'm also really proud of the work I did with Otis Pitts and his team to really, and I can't thank Patrick Dowd enough for really shepherding all of the new regulations we put through during my time here, including an innovative and one-of-a-kind Mon Valley air episode rule, updating the food regulations, the plumbing regulations. I know they're working on the housing regulations, amongst others. So again, that is because I was able to bring in really strong, amazing leaders to the health department with your support. So I think I'm most really proud of all the work that's happening across the health department, and the sense of community and really devotion to Allegheny County. And you lay that, you clearly love the county, and that I think made it clear to all of us that we also want to really work to better the county. And so you supported us when we wanted to come forward with innovative ideas. You're like, yep, do it. And so I'm really proud of that attitude and the team we built, and the legacy that I left here of that amazing team that carries the work forward.
From my perspective, in public health, your success is not your success alone. It is really the success of all the people that you are working with, including those who work for you, but those who work with you. And I think the team that you, Rich, were able to put together at Allegheny County made all the difference in the world for me personally, in supporting the things that I was trying to do and also helping to shape them. And I just think that in public health, we really have to see public health as a community responsibility. And as I said, no one person can hold it on their shoulders. So I really appreciate that. And thank you for that.
So Rich, you have been the county executive for over half the time that I've lived in the county, and you really set the stage for the work that we do. And so really, my time at the county was really, I felt very blessed to got to work with you and your strong team, really supportive team. And so I just want to thank you for my perspective as a resident of the county, for all the work you've done and for your support of me. I'm sure that I, in part, owe my current position to you and the supportive environment you created for me to be able to do the work I did here. So thank you, and I wish you the best of luck in your whatever comes next for you. And I look forward to riding more bike rides with you in the next decade or two, so we grow old and can't ride bikes anymore.
Thank you for joining us for Conversations with the County Executive. Please come back again for future episodes, and for any information about everything that the county is and will be doing, visit AlleghenyCounty.us.